Let's go into the introduction. What is the outpatient department or OPD? OPD is a section in the hospital that takes care of patients that do not need overnight stays. So, what are the current issues ongoing in this department? One of them is the long waiting time, poor communication and coordination between the medical staff and the patients, and including the inefficient workflow and data management. So, what happens when these issues are not being solved? So, when these issues are not being solved, there will be effects both on the healthcare system and patients, which are increased workload and burnout of the medical staff where this will make the patients will feel dis- dissatis- dissatisfaction and decreased trust due to frequent bad experiences within the OPDs. So, what are the solutions? We will find out in the solution slide.
The first issue that is going to be discussed in the outpatient department is the long waiting time. This is because in the outpatient department, there are a lot of patients coming from everywhere. So in this department, usually the patients are having chronic diseases such as diabetic and also high blood pressure. So there are also patients from old or like aged people. So because of this, they have to queue for a long period just to get their treatments. And then other than that, there is a shortage of staffs and the doctors. Even though the number of patients keep on increasing every day, but the number of staff does not increase. So it does not go directly proportional. Therefore, it also increases the waiting time for the patient to get their treatment. And because of this, it kind of burden the patient, because imagine if the patient has to go to work and they need to go to the hospital early in the morning, for example at 8 a.m., just to wait for their treatment, just to wait to get their treatment for 2 to 3 hours. And then after that, they have to go back to their work. But then it's such a waste of time, because those 2 to 3 hours or even 4 or even more, it's not a full period of getting their treatment, but instead it's just a period of waiting. So it's going to make the patient stressed out and wasting their time. Another issue is regarding poor communication and coordination. We know that in this department, every time the patient come for an appointment, they're not going to see the same doctor to get their treatment or to get the diagnosis that they want. So because of this, you know that certain doctors don't have the same way of diagnosing the patient. So therefore, sometimes or most of the times actually, the patient might get clash information from the previous doctor to the current doctor. Like for example, the previous doctor might say that they have different type of disease, but then the next appointment when they come to the hospital again, and then the next doctor, the current doctor who's diagnosing them, might say that they actually have a different diagnosis. So therefore, this might cause confusion to the patient and also between the doctors itself. So another thing is regarding handling the patient's behavior. We know that there are a lot of patients and everyone has their own type of behavior. So doctors must have a very good communication skill in order to deal with these patients and also with their families, especially when it comes to making decision for their treatment and so on. When it comes to making decision for their treatment, maybe it has to cost a lot of money, and some patient doesn't have a lot of budget for that, and because of that, these doctors must come up with some alternative and try to discuss with the patient and their family without causing any problems. Lastly is regarding inefficient workflow and data management. So basically, there are a lot of uncoordinated process where the data of the patients are not being arranged in the right manner, and also there are redundant tasks they have to manage, and also there is a lot of changes from the paper-based form into the digital system. We know that when it comes to paper-based, there are a lot of things that we have to do manually, right? So when the process of changing the paper-based system to the digital system takes a lot of time, and because of the redundant tasks that they are delaying right now, has also causing the delay in the time for the patient to get the treatment, because the whole process is not done for the data management. So when the data is not done, therefore the patient will not get the treatment because the doctors cannot arrange all of this process for them. Therefore, this is also one of the biggest issue that is raising right now.
The solution is make an app. So what will this app has? First, is an appointment system where the patients are able to choose any of the slots that can fit into their busy schedule. So this helps so much for those who are working professionals, student, caregivers who are who have a lot of commitments and others. Now these features offer a better patient flow and reduces time spent waiting for consultation. Next up is the live chat. So these features focuses more on wherever, whenever the patient is, they can chat live with a medical staff to get medical advice. This live chat is 24/7, so patients are able to chat with the medical staff even during night times. So with this feature, it is able to calm down any anxiety or fears by the patients by giving them immediate access to professionals for quick clarification and reinsurance. Now, finally, this app can help in managing the data where there are still some hospitals, like the hospitals in Bukit Padang, Sabah, where they use paper-based system, which causes difficulty in tracking the patient's informations. So with this app, the patient's data will organize electronically and allows healthcare staff to properly access the information such as past consultations, what kind of medication taken by patients, and other relevant informations.
While the proposed medical apps hold its significant potential, however, it is important to anticipate future issues that might arise. First of all, the medical apps that often handle with highly sensitive personal health information, including medical history, treatment plans, and diagnostic data, might cause issues related to data security and privacy, as they might share the data to the third party, such as insurance companies, research institutions, in order to enhance their services. Although this collaboration may offer benefits to the user, but the insecure connection between the apps and the third party can compromise the security of transmitted data. And apart from that, a considerable number of users, especially the elderly, may face difficulty getting used to the medical apps. This may be happen because the feature within the apps may be too complex for them to explore independently. Not to mention that the elderly also often had problem with their eyesight, which may difficult for them to read or input data within the apps. Also, both of the patient and their caretaker also might find some medical terms used in the medical apps unfamiliar, which might discourage them from using the apps. Next is limited access to the internet, particularly among the rural and remote communities, where they face difficulty in obtaining dependable internet access within the household. So, as a result, they might find it is empirical for them to effectively use medical apps due to the limited or poor internet connectivity. And lastly, no matter how advanced the technology it is, there's a still potential technical issue may still arise within the app, and this can affect the app's performance and user performance negatively. Also, the technical issue also might lead to the loss of the data stored in the cloud within the app. As a conclusion, by addressing current challenges and anticipating future issues, the proposed medical app has the potential to enhance the efficiency, accessibility, and the overall quality of the outpatient department services.